October is Breast Cancer Awareness Month, which means it's the perfect time to schedule your mammogram. Today's CI Health sponsor is our friends at Carle, and we have Hannah Dignan, the advanced practice provider, and Mary Van Cleve, breast cancer navigator, here with more details on the screening and new services available. Welcome, ladies.
Thank you.
Okay, so Mary, we're going to start with you. Let's talk about what women and men need to be on the lookout for when it comes to breast cancer and preventing it.
Okay. Well, for prevention, really, the best way they can do is, well, for women anyway, is to get annual mammograms. And for anyone is to be aware of your own body. In other words, make sure that you're looking at yourself, do your self-breast exams, even men, and let people know if there's some sort of problem or something new.
I think that's surprising to hear men need to be doing breast exams, because I would not know very many that I would think would do that. But
it's really rare for a man to get breast cancer.
But it is possible.
But it is possible.
It is possible.
It is possible.
Okay, and then also know your family history. That is so important. Because I'm going to guess if you have a family member or a loved one with breast cancer, definitely schedule that mammogram.
Absolutely.
Okay, if you notice something, then what?
Well, if you see something, and that's really any kind of a difference, any kind of change in the skin, any kind of changes in the nipple area, any discharge, anything like that, a redness or the skin looks thick like an orange, or not that color, but thick like that. Those are the things that you are looking for, and then you should be calling your doctor.
And that goes back to know your body, know exactly what's going on, so that when something changes, you'll be aware. So Hannah, let's talk a little bit about the latest and greatest things happening there at Carle, facing a breast cancer diagnosis.
Well, great question. Yeah, so we are expanding our services to now offer a high-risk breast clinic. So we are able to see those women who are screened by their primary care, who are more at risk for developing breast cancer. Those would be with a family history or abnormal diagnoses in the past. But we also offer things like 2D and 3D mammography. We have a breast MRI. We also offer clinical trials and ability to get in with a multidisciplinary team. So we really do offer a comprehensive care solution for breast cancer.
Can we talk a little bit about the difference between the 2D and 3D mammograms? Because obviously 3D would be a little bit more inclusive, I guess, in what's going on with the scan. But why would you choose one over the other, or do you really need a 3D one if you got 2D?
So actually, that's a really great question. We actually have a clinical trial that's going on that I believe is still enrolling patients that women can enroll when they call the Cancer Center Research Department, that will randomize people between the 2D and 3D mammography, because we're essentially trying to see whether or not there is survival benefit to having the 3D mammogram.
Interesting. I know from having my own mammograms done that it was recommended to get a 3D because of having dense breast tissue. So then that makes you curious as to exactly what you may be missing on that 2D mammogram. So that's good to know that that's an option there. Okay, let's talk a little bit about how patients are treated maybe differently at this high-risk clinic.
So the high-risk breast clinic is kind of a newer thing that we have within the breast center. So these are women who, like I was mentioning earlier, are identified as higher risk due to family history, due to abnormal mammograms or abnormal pathology when they get a biopsy. And these women are sent to me, and we come up with a comprehensive plan for their treatment. So that could be, you know, like you were saying, like they recommended additional imaging. We can recommend breast MRIs, breast ultrasounds. We could even potentially offer them screenings to genetics. and come up with a kind of a comprehensive plan from there. Maybe even a little chemo prevention, which is a pill to help reduce their cancer risk if it is quite high.
Wow. Okay. Well, who knew? This is exciting things happening there at Carle. And for more tips, we've actually got a few more on CILiving.tv on what you should be on the lookout for breast cancer and at what age. CILiving.tv. We just ran out of time, but we'll have that shared a little bit on our website. Ladies, thank you so much.